show. This is NainaMD, Fusion of Science and Beauty. And here in Beverly Hills, I want to bring you all the latest and greatest in our health revolution. I really call it a health revolution because we are in an era where we're looking for answers more than just, just taking acute care of ourselves. And so today I have a very, very interesting guest. His name is Dr. Robert Young. He's a naturopath, physician for over 30 years, tremendous, tremendous experience. I can't even count the number of books he's written. He continues to write, and he has 3 centers, one in Italy, Como, Italy, a detox center, one in San Diego, the pH Miracle and Center, and also one, the Universal Imaging in Los Angeles. Again, I'm so thankful that you came to the show, and please welcome you to the show.
Oh, when I heard you invited me, I was right here, and I had to drive 3 hours.
Thank you so much.
So no, it's a pleasure being here. Absolutely.
I think it's so important because the whole idea of the show is to bring respectability, credibility into anti-aging, regenerative medicine, integrative medicine, and to know that there's evidence-based, scientific evidence-based that exists in all of these so-called theories that we have. So one of the things I want to open up is what this pH, the pH of the body, alkalizing the body. We hear these terms, and so many of the conventional doctors just kind of like, they like look at it and say, well, pH of the body, well, you're already alkaline. You just, you can't even have water that's alkaline. And, there's so many myths about even the kind of water that's alkaline that we're drinking. And, bring the evidence-based into this.
Okay.
Yeah.
Well, there's two basic theories. The first theory is that the human body is alkaline in its design when we're in perfect health. The other part of that hypothesis...
And what alkaline? What pH?
Alkaline at a pH between 7.365 to 7.4.
Yeah.
And we're talking about all the body fluids.
Right.
The problem with medical science today is they're measuring urine and they're measuring blood, but that's fairly constant, and the range in measuring pH of urine, it goes from 5.5 to 8.5, and 1 point is like 10 times, it's exponential. So if we're talking about a pH of 5.5 to 6.5, that's 10 times more alkaline or 10 times more acidic.
Got it.
If we're going to 6.5 to 7, that's 100 times.
Got it.
And ideally, our body fluids are alkaline at 7.5, so if you have a urine pH of 5.5, you're 100 times more acidic in the interstitial fluids. Wow. The interstitial fluids are the fluids that surround the cell, but nobody's testing those. They test urine, they test blood, but they're not testing the interstitial fluids because the body's going to do everything it can to maintain perfect pH or pH balance of the fluids of the blood, while the fluids inside that surround the cells and inside the cells are actually what's altering. Yeah. So in our lab, we're probably the only lab in the world that's actually testing the pH around the cell and inside the cell to see whether or not you're in metabolic acidosis or metabolic alkalosis.
Yeah. Because metabolic acidosis in conventional medicine is where you get this puncture, in the artery.
Right.
And they take out the blood, then you send it to the lab, and then they measure the pH of in the blood, and then they come up with like the sodium bicarbonate and and chloride, and based on all of these several indices, you say, okay, is that patient in metabolic acidosis or metabolic alkalosis?
Right, exactly. Yeah. And the problem is when your blood goes into alkalosis, that's the body trying to manage and maintain an acidic lifestyle and diet. But it's called compensated acidosis, where the blood maintains its pH while it's pushing out all the toxins out into the tissues. And that's why we get sick, because sickness and disease is the body's inability to remove its own metabolic waste. And so where does the body put it? It puts it into the interstitial fluids, which are the fluids around the cell, and into the connective tissue, and then into the fatty tissue.
And that's where this is where I get so excited, because we are doing so many procedures aesthetically. And here in Beverly Hills, I do a lot of aesthetic procedures. We have lasers, we have body sculpting that's going on every single minute. Somebody or the other is getting a treatment done.
Right.
And what they're not understanding is that when our fat cells store these toxins. Okay?
Exactly.
And when we do these procedures that cause a sudden release of these fat cells are suddenly dying, and you think that's a great thing. Long term, nobody is doing those studies. In conventional medicine, where are those toxins going? They're being released, and we're just like calmly sitting and saying, oh, but your lymphatics can clear, they clear all the toxins. Well, a lot of times women have had, and men have had procedures where their lymphatics are also have been hampered, so to speak, by surgical procedures, right? And again, the conventional medicine says, well, you only need big lymphatics, you don't need small lymphatics. So what I'm saying is all of this is leading, even cosmetic procedures can lead to this thing of releasing toxins, acidosis type, environment.
So one of the easiest ways to understand this is if you've ever cared for like a swimming pool, what do? You check the pH every week, and if it goes down, what starts showing up? Bacteria and mold and algae.
Right.
And so if you don't check the pH of your interstitial fluids or your body fluids, and that starts breaking down, you're going to be in trouble. And for a woman, if acids are not eliminated, they can go into the breast tissue. And if it goes into the breast tissue, then you're a candidate for breast cancer. Yeah. Because it's acid that causes breast cancer. It's acid that causes squamous cell carcinomas of the skin, melanomas. I mean,
and it's the acidity too that causes low oxygen, isn't that? Because when you're in an acidic state, you hold on to oxygen. You don't release the oxygen to the tissues as well.
Well, you don't have enough oxygen, and when you're depleted in oxygen, that changes the environment. And when the environment changes, then cells transform. It's not that skin cells are cancer cells; they become cancerous because of their environment. So, a very simple metaphor: when the fish is sick, what would you do? Do you treat the fish or change the water?
Change the water.
So the fish is only as healthy as the water it swims in, and that water that surrounds all of our cells has to be in an alkaline, pristine state. And so pH, which stands for the power of hydrogen or the power of protons, is really, in my world, is perfect health. pH stands for perfect health. Yeah. And when we achieve an alkaline stability, then we can manage and maintain the quality and quantity of our life. Just like we're doing with a saltwater aquarium, if we're doing it with shampoos, pH balanced shampoos or lotions and potions. I mean, the pH is very critical. But probably the most important thing anyone can do is start changing the water that you're putting in your body. Start drinking alkaline water, because oxygen water or pH water carries more oxygen. And that's going to provide more alkalinity.
Right. Tell me, let's start before the water, let's start the diet. Well, you've written the book, this is a tremendous book. Audience, you have to read this book. This was actually the first book I read of yours.
Right, yeah.
And it was so, amazingly, I just got so much information from this. Can you give us some idea about, there's certain foods, right, which can increase alkalinity, is that right?
Absolutely. There's foods that can heal and provide that perfect health that we're trying to achieve, and there's foods that will present more acids that will actually cause an environment that causes cellular breakdown.
Exactly.
So those foods that heal are plant-based foods. We're talking about green foods, a plant-based organic like broccoli or spinach or celery or cucumber, where on the fruit side you're with peppers, green peppers, you're with cucumbers, green cucumbers, and probably one of the most important foods is avocado, particularly if you want to have healthy skin.
So avocados is great.
It's the food of the gods.
Wow. Did you hear that, everyone? It's the food of the gods. Absolutely. And I eat avocado whenever I can. I put it in my salad. I use arugula, and I do
all of that is wonderful.
Use that. I do a little balsamic vinaigrette. And but that's how I do it. I make it kind of more consistency. So I think this is an amazing tip. Also, what is about the water? Tell me about pH and alkalinity, because so much of conventional medicine says, well, if you have so much alkaline water, you can damage the kidneys. So can you give me some idea and clarify that for the audience?
Well, there's great research out there, published research on how the kidneys love and adore alkalinity. In fact, the more alkalinity you can, it supports the kidney to help it release, which is its function, to release metabolic and dietary acids, and then pull back water that's full with alkaline minerals of sodium, potassium, and sodium bicarbonate. So the kidney
is a detoxifier.
Loves alkalinity, and the more alkalinity you can give it, like salt water with some sodium or baking soda in it, the kidneys can get healthier and healthier because they thrive in that environment. And it helps to support the kidneys to do their job, and that's to remove the acidic waste that's produced through metabolism.
Yeah. And I think when you say things like this, like, the alkaline water and being good in people with, even for the kidneys, I think it needs to be that that's all combination with the lifestyle, with changing of your diet. If you're still going to do Cokes and all of those things, and you do the alkaline water, it may or may not benefit you. If you've got other issues happening, but you're not willing to make those changes, yes, maybe certain things then are going to aggravate that situation. So I guess what we're trying to say to you is make a lifestyle change. Change yourself by changing your lifestyle and your health. And there are easy, simple things that we can do. Start with an avocado a day, right?
Absolutely. An avocado a day, we're substituting that instead of an apple. Yes. An avocado a day will keep the doctor away.
There you go.
And it's 80% fat, yes, but it's good fat. Yeah. And it's 15 to 20% protein. So you're getting a good source of protein, and then some of the research with lutein as a powerful antioxidant will help to neutralize the acids that cause cancer, prostate cancer, breast cancer. So when we're eating avocados, we're actually eating a food that's going to protect our body and help to manage and maintain that alkaline design. And
that's what you do. You had this amazing center that you have this amazing, you actually are in control of the meals that are given when people come to your center. And it's amazing.
Exactly. We eat what we grow and grow what we eat.
He grows this tremendous food, and then you have these recipes, and then you make this food, and people come there, with all these ailments, and they're feeling so much healthier when they actually leave that. It is a miracle center. It's a pH miracle center, and it is truly a miracle center because you leave feeling so healthy. And what you've done is you've just, with all of your knowledge on all of this, is you're guiding what kind of foods and how to even combine the foods is very important.
Well, yeah, like Hippocrates said, let your food be your medicine and your medicine your food. And I strongly believe that 95% of all sickness and disease is caused by what you eat, what you drink, and what you think. 5% is only genetic. But even when we're talking about genetics, those genetics are triggered by what you eat, what you drink, and what you think. So 100%,
yes.
100% is within your control. So you can't blame your mother, your father, your grandparents. You have to take responsibility and take control of the quality and quantity of your life. It's your body, it's your life, and it should be your choice. So I am a proponent for people to have the opportunity to choose the type of quality or the type of care, to be able to choose their own doctor rather than being told you have to have this treatment, you have to go to this doctor. We need to take back our health. We need to have health freedom here in America. And
health revolution.
And integrated medicine, complementary medicine, traditional, conventional, whatever you decide. It's your life, should be your choice.
And thank you so much for coming on my show. And I would love it if you could come on once again to the show. We'd like to talk a little bit on the next show about cancer and cancer prevention. But again, this is Dr. Robert Young. He's internationally known. He's one of the most amazing doctors that I know, written many, many books. Please look. This is the newest book, is Reverse Cancer Now, and phmiracle.com.
Yeah,
is that the
phmiracle or foreveryoung.com. If you want to stay young, that's my last name, so I'm going to be Forever Young, but it's with a PH. Yeah. Forever Young, not an F, but with a PH, foreveryoung.com.
You got it. So you heard it. And again, this is NainaMD. I'm going to be back with my next guest. Again, amazing guest. Thank you so much. And I'll be right back.